welcome everyone today. Today's NDF and Gallup webinar series. And today's basically discussion is focusing on health messaging during COVID. And we'll particularly focus on two scientific areas, if you call, basically looking into the behavioral insights, looking into the behavioral science and the design thinking field. And we'll understand the messaging campaign which was done through the ringtone and the evaluation process and how it was developed and what was the whole aim of it and how it worked out. So first of all, I will introduce the panel. We've got Dr. Asma Humayun. She's a member of the Royal College of Psychiatrist, UK, and she has like 25 years of experience in clinical healthcare, service development, and capacity building. We've got Javeria Masood from Innovation Lab, UNDP, Pakistan. Then we have got Umar. He's a behavioral scientist. Then we've got Bilal Gilani, who's an executive director at Gallup, Pakistan. So before we go ahead with the session, I would first give a brief introduction about today's session. We will be focusing on how messaging has been effective and how it has been instrumental during the COVID period, and how these strategies have been applied by different think tanks and how they have been used. So particularly, we'll be focusing on the ringtone messaging and development and how these soft methods can actually empower people to understand the importance of social distancing and all the particular SOPs which are required to protect themselves rather than getting into a lockdown and being restricted forcefully, to be honest. And it obviously impairs everyone in economically as well because of the livelihood and everything. So first of all, I am very keen to understand what are the behavioral best practices and how does the behavioral science looks at the messaging campaigns, especially related to the COVID situation, and generally as well, how do they form evolution across the time and the process, and what's the process behind this? So I would like Dr. Taj to actually answer this and basically start the discussion from this question.
Sure. Thank you very much, and thanks for having me in this discussion. So to put very simply, behavioral science offers a new way of thinking about solving problems. Why? Because there's predominantly, whenever we're thinking about change, there's predominantly an economic way of thinking, which is coming from economic theory, where the understanding is that people are rational, they make decisions rationally. So if only you tell them what is right and what is wrong, they will be able to weigh the costs and the benefits and will end up doing the right thing. Right? So quite often, what this way of thinking leads to is us, creating campaigns in which we are just stating them. You know what? Look, COVID is so bad. See how harmful it is. Therefore, you should do X, Y, and Z things. Right? And the underlying assumption is that if only we tell people that this is so bad, people will realize the consequences and will therefore automatically end up doing the right behavior. But when it comes to practice, we know that quite often is not the case. So clearly there's something else which is explaining the behavior of people. And behavioral science then comes in which it borrows insights from psychology, from neuroscience, and even from economics to try and give a better explanation of why we do things the way we do, and then what might be the insights that might influence. So when it comes to Covert messaging specifically, there's already a decent amount of literature telling us what kind of things would matter. So for instance, who the messenger is going to matter quite a lot when it comes to whether people are going to listen to that person or not. So when we are thinking about Covert communication, we need to be very careful who is delivering the message. The second thing is about what are we telling them? Like, are we instructing them, or are we actually giving a reason of why they should do it? So in the ringtone message, you might, and I'm sure most of the people would have heard that at one point in time, there was this message in which we explained how it transmits. So we were saying the droplets would come out from the mouth and they could fall and they could enter through eyes, nose, and mouth. And once you explain mechanism, then we are saying, well, now if you wear mask, and now if you keep distance, or if you should wash your hands, we know already from behavioral science that if we give an explanation of why you should be doing something, people are more likely to do it rather than simply instructing, right? I think the third important thing is about fear. So we already know in the literature that fear-based messaging, when it comes down to pandemics, does not work, right? And what we have tried to do in the messaging as we moved along and along with our partners, it's not only us, wherever we could contribute, it was us sharing this insight that let's move away from fear-based messaging. So what would be fear-based messaging? If you don't do this, then all of these bad things are going to happen. And rather, what works is improving the self-efficacy of the people, right? So yes, there can be negative consequences, but if you do X, Y, and Z, you will be able to, counter, right? So that already we know that improving self-efficacy is quite important. And I'll just stop at the final point, and I'm sure we're going to come back to it as well, is around people doing actions because it would harm them versus because it would harm someone who they love. So again, we already know within behavioral science that if I tell somebody who might not feel as, who might not think that they are facing, there's a greater chance of them contracting COVID or any of its effects. If I tell them that, you should do this because this would, help you save your life, or this might harm your health, then if you already think that there isn't much of a chance, it's not going to be as impactful, right? Whereas we are more likely to take action if as a result of that, we are trying to save our loved ones. So again, you might see, and we've been trying to push this wherever we can, that whenever we are creating COVID-related messaging in Pakistan, let's try and shift the focus as much to your family. So if you're young, you might actually end up harming the health of your dadi or your dada or your nani or your nana or your parents who are probably at a greater risk. So trying to shift this consequence rather from you, but to your family, we already know from evidence, not in Pakistan, but outside, that helps people then carry out the desired actions. So this is just an example of a few what we call behavioral insights, which then when you are writing comms, so whether you're sending on an SMS or there's a robocall, or in our case, the message that got recorded in the ringtone, well, what should we say in that? This is an example of some of the insights which we try to share with the partners to then embed in the messaging.
All right. So I would basically extend on this as well. What do you think in terms of the public policy side as well? If according to like the lockdown is eventually getting over, and some of the people have the perception that COVID has actually finished and stuff like that. How does that change can be developed through these messaging techniques, and what are the ways to test these messages? For example, if you're developing a campaign, what are the testing methodologies to understand that this type of testing would actually work for this type of audience?
Yeah. I mean, I think that's a really good point, which is, ideally we should move towards, and this does happen in a lot of countries, where you don't need a lot of resources, but you could try and quickly test a few different variations of a message, and try and get some sort of a judgment on which one works better than the other, right? I think that's quite important. So you're thinking about how do we test it? So there could be, there's a few different ways. One is simply, let's say you create 3 versions of the text, and then you send it out to a smaller group, and then you ask them, well, read this message, and how likely are you to carry out certain actions if you were to read this message? From a scientific point of view, that is just self-stated, right? So it might be, people might say, oh yes, in this message I'm more likely to, but they might not end up doing that. So a more rigorous way then becomes somehow you trying to observe the behavior as well. So you create messages, create 3 groups, send messages, and then you observe that behavior.
All right, thank you. My next question is basically focusing on the Digital Pakistan initiative regarding the development of the ringtone campaign and the whole story behind that process of development. Javeria, can you please tell us about that in terms of the development, and how was the development phase and the evaluation phase of it?
Sure. Thank you for the question. So I think it was end of February when we saw one of the first few cases that were starting to surface from Pakistan. And very immediately, a COVID response war room was made or housed within the Ministry of Health, and it was in collaboration with Digital Pakistan. The initial set of responses were very fast and very considerate of the human element as well, because suddenly there's a pandemic that we know nothing about. And the initial set of information regarding precautions was coming from, WHO, and there was very little local knowledge, even in the medical domain, right? So I got involved in the work from the war room at the very beginning, and it was a lot of a lot of organizations and a lot of individuals coming forward and with the spirit to just help. So very initially, in the first 1 or 2 weeks, a platform was built for the same purpose of communicating the actual current situation of COVID, so that people know what is happening, how many cases, where exactly in Pakistan were most cases coming from. So a platform was built regarding it. And at the same time, this idea of ensuring that masses need to be made aware. And then that's where, the whole comm strategy was starting to be designed and developed. And very, very quick answers was, okay, let's just put it on social media, right? But then how many people actually go on social media and go through that information? And then even social media is so huge. So and that's where, even you mentioned design thinking. So even in design thinking and design practices, what really embeds is the human centricity element. So bringing and understanding how human psychology really works. What do people listen to most? Who do they listen to? As Umar was also explaining, what influences our decision making? Where does our, so one thing is to know something, another is to act on it. So how do you actually engage both sides of your psychology? So on that account, a lot of messaging was, developed. And then, of course, there was this understanding of who are our persona sets all over Pakistan. There's a set of people who believes in myths. Then there's a set of people who will believe anything that who they believe in will tell. For example, a lot of people follow the religious scholars. So anyone from the mosque is saying something that is more likely to be heard. Who are some of the other influencers, right? So incorporating all of those personas, we try to figure out what are the best mediums. Of course, a multiple of mediums were explored, like newspapers, radio, television, a different kind of campaigns on social media. And then when we tried to do a statistical analysis, we found out that a large majority in Pakistan does not have access to smartphones or does not have access to internet or are not even internet literate. So how do you ensure that your messages reaches to them? So content is one thing, but then medium again being very important. So that's where, you know, this idea of ringtone came in. And I have to say that when I proposed this idea, Digital Pakistan people were super supportive. At that point, I think I've never before seen so many people on the same page with equal level of enthusiasm and support. And immediately, you know, we drafted a message, then we got it approved. Then our friends from eOcean came in, spoke to PTA, and then those messages were put forward. So just taking a step back and talking about what the first set of message actually entailed. So it was initially, you know, it had a few slangs or a few of those common colloquial language components that we hear. But then they were taken off precisely for the same reason, that they may hurt even 1% of sentiments of people. So you don't want them. That then time period is very crucial. So it's true that anybody who calls anyone will hear that ringtone, so it's very effective. But then when you pick up the phone, that might be 10 seconds into the message. So then the first 10 to 12 seconds become very, very crucial. And that's why you have to hook the people. You have to give them at least enough information so they can operate on it. So the first set of message talked about the precautions, that you have to frequently wash your hands, you have to maintain social distance. What exactly is social distance? How much distance qualifies as that? What are some of the other precautionary measures? How is this disease even transferred? And why you need to be careful. So again, as Umar was saying, the message had to be empathetic so that it relates with people. It had to speak to each of the personas. Despite the age brackets, despite the social strata, despite the usage of mediums. So it had to be a way that it should speak to everyone. Then it had to empower you that, you know, okay, fine, this is something that can cause deaths. It's something that's very detrimental, but there's a precaution. So you have an empowerment to act on something. Then what does those action entail? How do you go ahead with it? So it was broken down into those levels. And again, most important set of information being said at the very beginning, so you don't lose out on it. And then I think I let Bilal speak on when they found out the impact of those ringtones and then how we then translated into the next set of messages.
All right.
Thank you so much. Gallup got involved in first understanding the essentially the total size of the audience. So, I mean, from the PTA side, all the telecom operators were essentially asked to formally do that, and so we knew that it was being carried, but to what extent it was being actually heard. And then to what extent it was being heard in the sense that it is being noticed as well, or observed or felt or listened to as well. Right in the start of the COVID, we started almost a fortnightly polling tracker that was designed to understand the pulse of the nation when it comes to COVID. So we asked a few set of questions in those waves. We asked if people were listening to that ringtone, if they were listening to that ringtone, what they thought about the ringtone. And then we also asked a set of questions that were related to knowledge, attitude, and practices with respect to COVID. So to what extent people were aware of COVID right in the beginning when COVID was not a big threat. But then also to what extent they thought COVID is spread through, and people's attitude towards it, to what extent they thought this was a foreign conspiracy, if this was something that COVID can be actually avoided through, for example, wearing of masks, to what extent they thought use of sanitizers or use of masks was important. And then a lot of practices questions, to what extent they were wearing masks, to what extent they were avoiding going to mosques or avoiding stepping out, to what extent they were doing social distancing. And so essentially doing a lot of questions related to knowledge, attitude, and practices, and then doing a control treatment analysis and understanding to what extent people have been people who were actually being exposed to the message and people who were not, and if there was any difference in the in the in each of these three fields. So were people, the hypothesis was, are people who are listening to the campaigns, are they more generally more knowledgeable about COVID and correctly knowledgeable? Are they is their attitude towards COVID more positive in the direction that we wanted it to be, and whether their practices were also in line? With this particular sort of design of the survey and the control treatment analysis, we shared the data and analysis, and maybe Umar can shed more light on the actual findings and how the results translated into being to show a very positive picture.
Sure. Yeah, more than happy to. So again, one thing, if you want to try and measure impact of any intervention, you can do a few different things, right? The gold standard is what is called a randomized control trial, in which you randomly select one half of the group, and you expose them with a particular intervention, let's say a message, and randomly select another half, and you don't. That's the control group, and then you try and see, well, what might be an effect between them. When it comes to situations like COVID, I think this has happened in any country, that academics of whom I've had interactions with. You cannot afford to do randomized control trial, because the situation is so dire that you have to actually, whatever intervention you have, it has to go out to the whole population, right? And so then what comes down to us is, and this naturally happened when Gallup, with Gallup when they were doing their polling, we did see that there were some people who have heard the message fully, there were some people who have heard it partially, and then there's some people who said that actually they haven't really heard the message, which is actually plausible, because it's not that every person in Pakistan has a mobile phone, right? So that gave us sort of a natural environment in which we could say, okay, well, how about we try and see if there are any differences between those who have either partially or fully heard the message versus those who haven't really heard the message at all, right? One good thing is we had a fair majority of people who have either partially or fully heard the message, but then there was a decent chunk who said that they haven't. And we looked at these three things, which was knowledge. So looking at questions around knowledge, looking at questions around their perceptions or attitudes. And then third was their actual behavior, again, self-reported behaviors. And what we saw was that those who actually did hear the message, they were more likely to correctly identify the symptoms of COVID. I think that was, one big thing. They were more likely to perceive the seriousness of the threat that COVID might have towards them or to their family. They were less likely to consider that this is something which is exaggerated. Right? And they were more likely to agree that the government is handling the situation well. Right? So this was around perception. And the most important bit for us was the actual behavior, given self-reported, but even self-reported, what were they saying? So those who either heard the message fully or partially, they were much more likely to wear masks. They stayed indoors at like one additional day of the week, right, in the survey. And they were more likely to use soap or hand sanitizer. Okay? And for us, like these results, these differences between on these factors, they were statistically significant even at 1% level, which is quite a high level of significance. I do want to qualify here that we are not trying to imply that one is causing the other. So for any of the listeners who are more, who know statistics a bit more, right? Just for them and even for everybody else, the argument is not that the use of this ringtone message has resulted or has caused all of these different things. But what we definitely see is that there is a very strong relationship between these factors and those who heard the telephone message. So there's clearly some contribution that the ringtone message has made towards these positive results. They all moved in the right direction.
If I may add to some of the statistics that Umar alluded to. So, for example, in knowledge, the knowledge sphere, the people who had listened to the ringtone were 71% more likely to correctly identify fatigue as a symptom. Or they were 53% more likely to correctly identify breathing difficulty as a symptom. In terms of behavior, for example, they were 43% more likely to wear masks or 45% more likely to use sanitizers. In terms of attitudes, 11% were more likely to agree that government is handling the coronavirus well, or 31% were more likely to perceive the seriousness of the coronavirus threat to them or their family. And as we looked at these results, I mean, we've done such controlled treatment experiments before. In my personal experience, this was a very, very clear indication and a very clear verdict that the campaign was actually working well in changing people's perceptions, and not just perceptions, going the next step of actually changing attitudes and behaviors as well. So in that sense, it's a wonderful initiative. And I mean, especially if you put these results with the perspective that essentially the campaign did not cost significantly any amount, except for the development work, which again was being done in a very large number of ways pro bono. So the idea that a campaign that is well thought through and is carried on to a vehicle that reaches a very large number of people, and that there is a scientific or a systematic way of doing it, can essentially lead to behavior change to whatever extent it does, and to whatever extent we can measure such changes. I thought in my particular experience, this has been a very large success.
All right, thank you, Bilal. So moving on towards understanding the mental health constraints as well, in terms of what has been the impact of COVID, especially on the mental health side. Dr. Asma, I would like to get some insights from you on this particular area.
Thank you, Mubashir. I realize that I'm the only one in this discussion who has not been part of this wonderful initiative. And it has been a pleasure for me to hear the background work and the scientific approach. I'm particularly very impressed with the idea because it reached over 100 million people, and also because you've been able to evaluate the results, because unless we evaluate, not learn lessons for the future. So very impressed with all this. And really, I mean, there is something that I'd like to say about the communication strategy, particularly in relation to healthcare, before discussing the mental health impact of COVID on the population. I mean, two things. I'm going to discuss two aspects, I think. One is that what is the role of communication skills in healthcare anyway? And the second one is particularly in relation to COVID and the public health messages, because in my lifetime experience, this is the first time that we've had to deal with a public health emergency at a national level, and the communication strategy is evolving as a result of that. So the first skills are extremely important is because we are struggling. Our healthcare infrastructure is inadequate, and the resources allocated to it are mismanaged. Mismanaged, I say, because the priorities are not determined by the population needs. And behavioral approaches, which are based, like all of you have been indicating, on knowledge and skills and attitude, they are not aspects into health, very important points. So if you take the same context of a clinical consultation where it was between a patient and a doctor to a larger scene where there's a public health crisis, you can very easily identify that the communication in a public health crisis becomes even more important. And the prerequisites would again be that we need to form some kind of trust with the audience. Number two, we need to convey accurate information. And number three, if they have any questions, we should be there to understand where the gaps are. So some of you rightly pointed out that in the understanding of people, so that your strategies could then target those. So coming back to the messaging services, I mean, there are certain points that I'd like to say about how public messages should be devised. Now, the ringtone messages are, I'm going to pick certain examples from, of course, we have to messages. The first one, Digar Meljol mein 6 foot ka fasla rakhe, something to that, something like that. So, Peshawarana and Digar Meljol is not everyday Urdu. Okay, so to reach an audience, most of who might not be health educated in that way. The second is that the content has to be very scientific, and I'm most impressed with the ringtone messages because this is the first time that we are looking at highly scientific content. But one example of how the information was evolving and how the ringtone messages had to change and evolve also comes from the symptoms of the illness. Because if you look at the first message, the symptoms were, fever and cough. But the second message incorporated breathing difficulty also. So this was, again, a very good example. An important point that I'd like to mention here is that the human capacity to register new information is 7 items plus minus 2. So any message should not have a lot of new information in it. When we start the messages, when we say that the virus can enter through nose, mouth, and ears and eyes, basically this is not chunked, and a person will look at 4 points of entry as 4 new information. But by the time they are familiar with it, then this will be chunked in their ability to register and will be considered only 1 item. So the first item where you are saying exactly how the virus can enter, and then there's surface also. So 5 important pieces of information are already going into it. In that way also, I'm very impressed with the messages, because I was looking down at the content, and except for one which was related to Eid, and there was some extra information there, but other than that, the messages were very brief. The third thing that I'd like to say is that rehearsal is extremely important when you're doing public health messages. Rehearsal means that the more people hear, the more highly likely it is that they'll remember and practice. And ringtone was a brilliant idea. And what it did was that they rehearsed it, whether they liked it or not. Every time they were using the phone, they had to listen to that, and therefore some information was being stored in their memories. What would have been even better if we were able to form a national communication strategy, and there was a task force, which has happened in other countries, and which is what the recommendation is. And as a result, these messages are designed centrally, and then they were to go to all private channels, TV channels, so that instead of showing a new animation video every time or broadcasting a new message, the same message, the same language, the same words are broadcasted everywhere. And that would have even a greater impact. It's extremely important in messages to avoid ambiguity or confusion. I remember somebody shared a picture of a banner which was put up by the local government in Sargodha, which said that wearing a mask is not essential. So these kind of contradictory messages cause harm. So the next point is that it's important that message is delivered by somebody people trust. I think one of you mentioned this earlier on, and it's extremely important that people, for example, doctors people trust, doctors should be relaying the message, or your national heroes should be relaying the message, or sports celebrities, and this was also seen along the way. With the telephone, what happened was with the ringtone that people trusted that this was like state doing it, and therefore this was official, and therefore this content was valid and reliable, and therefore I think it was very useful in that way. In COVID, the messages faced some challenges which we don't see in, for example, other health campaigns, for example, vaccination campaigns. Here, we had to deal with a lot of uncertainty. And for public health messages, they should be smart enough to deal with uncertainty where we do not know. Instead of speculating, saying that this information is coming in and we would know more about it later on is very helpful, and it helps build trust. I think Javeria mentioned earlier on that this pandemic, what it did to people was that it took their sense of agency away. So there is no treatment, there's no vaccination, and therefore people are left in a fearful state. So the message, the tone of the message had to be so carefully tailored that it should not be too reassuring that they don't go and take the precaution. At the same time, it should not cause further threat or harm to them. So my congratulations to all of you for doing this brilliant work. Coming back to the mental health impact of COVID very briefly, I think that I would like to say that the first important thing is that I hope Bilal is interested in collecting information for us for mental health impact of COVID, because we do not have data. So this is important because unless we collect data, I can tell you from anecdotal evidence, and I can tell you from what other countries have said. But really, there is no way I can tell you how COVID has impacted people in Pakistan. From my clinical knowledge, I can tell you that there was a lot of scare, and that people were afraid, and even people who were close to me, my friends and family, and people I worked with clinically, I saw this. But there is a lot of resilience in the system, in the population, and how people coped with that, and families came together and supported. So I'm not in a position to say that we've had a rather severe impact in that way where people have not managed it. But what I would like to say is that the vulnerable population, which should have been identified and which should have been supported, we weren't able to do that. Who are the people who are more vulnerable? So the most vulnerable people in this are those who have pre-existing mental disorder. And the services were shut down immediately. And therefore, I saw a lot of crises for people who were already on treatments, either because they couldn't get their follow-up appointments, or they couldn't get hold of their medication in time, or they were not attended in emergencies because the psychiatric departments have been shut down. So the next vulnerable population have been the children and adolescents, the teenagers. And again, there have been smaller projects to look at their mental health needs and to support them, but we've not had any substantial way of knowing this impact or providing support to them. Women have been at the center of suffering because of the COVID, whether they were working outside home previously or they were housewives. I think their workload and their stress increased multiple times. And there are numerous examples that I can give you, but I would certainly like to mention the possibility of an increased rate of violence at home or in closed settings because of staying at home. So very briefly, I hope I have responded to your question, and if you have any more questions, I'm happy to discuss it further.
No, clearly you've answered the question. Thank you so much for these insights. So Javeria, I would basically like to ask you regarding, how do you think that design thinking can actually be utilized for future health-related messaging, and how can it be utilized effectively? So yeah, that's the main question.
Okay. Thank you. So before I answer your question, I wanted to take the liberty of pointing one thing out that Dr. Asma referred to. So she said that there should have been a centralized task force. It's sad if that has not come across very clearly, but there has been. So initially, the comms work that I mentioned that came out of that war room was actually with the involvement of a lot of people, and it was a risk communication and community engagement task force. The idea was exactly this, that same kind of messages, same content need to be repeated again and again through different media. We engaged about, Digital Pakistan engaged about 400 or more social media influencers. We got on board a lot of comms material experts to ensure that same material will be, developed. It will be approved, and then it will be segmented in different mediums and then go. But what happened also was that everyone was doing everything. It wasn't just limited. So that's where some of the ambiguity did come. And that's essentially also where we felt that the ringtone has to then be like this one thing that's customized, and nobody has a choice whether they want to listen to it or not. We also saw a lot of you mentioned repetition, and even though that's a great tool, we saw a lot of memes and a lot of satirical comments about, can we please get rid of this ringtone, but they did help quite a lot. This work, and this is after when Dr. Umar also joined us now in the recent set of messages. We've been even more conscious of how the changing situation need to also accommodate in our messages. Mubashir, you asked about design thinking. I'm actually going to take the liberty of expanding design thinking further and talk about systemic design.
Sure.
And I'll sort of define that, as in, what do I mean by it? So systemic design actually means that you are looking at the entire system. And design thinking is a part of a framework that we use for systemic design. The problems are when problems are so complex that they seep into all aspects of the system, our way of understanding those problems has to be similar, right? So when we're thinking of COVID response work, or more COVID response strategical work, because it's impacting, as we're discussing mental health, it's also impacting our larger economy. That's another aspect. It's impacting our social behavior, how we are with each other. We as a society is largely dependent on our social structures. A lot of our family structures are combined. So now with social distancing, the nature of those interactions has changed. If we think long term, do we foresee something more strongly coming into our, manner of societal, everyday urbanism? Then we have to also incorporate understanding toward infrastructure. And to give you an example, infrastructure can also be taken into environmental sense. Maybe there in future there's going to be housing which caters to social distancing, and then bigger questions like, do we even have that liberty of land and economics to do that? Then there's the larger environmental aspect. We're seeing a lot of usage of masks, hand sanitizers, a lot of gloves, a lot of precautionary, clothing items, and then they are once or twice used and then thrown away, and they seep into the larger, they sink into the environmental loop. So that's another aspect. So when we propose solution, it's important to incorporate all of these aspects and more, because it's something that's not just covering a single point. And ensuring that smaller interventions can actually impact or become catalysts for larger changes is sort of the undertone that one needs to have. And within UNDP, all of our projects that are coming in response or in consideration to COVID have that sense of inclusivity and longevity to them. Because as we're discussing, for example, comms material, behavioral insights, and mental health, it impacts the way that you engage. It impacts productivity. So many Zoom calls or so many, online engagement, it's very different from in person. It's much more, it's now proven, there are a lot of statistics that are showing that it's proven to be more taxing on your brain. So it has impacts. Zoom fatigue is a real deal, and that impacts your productivity. Your productivity impacts the economics, that impacts infrastructure, that impacts everything else, really. So the way that we're looking at is to ensure that there is a holistic approach toward problem solving, whether that is in response work or that is in policy space or that is comms material. So to give you another example, I'm seeing a lot of edtech material coming. So education, with schools closed, with institution closed, there was not much room for us to, because there was no warning call. It just, pandemic just came. So we had to immediately, very quickly translate into the digital space. Now work offices and institutions who already had an infrastructure in place were easy to do that transfer shift. But a lot of government schools or a lot of other schools, a lot of offices, a lot of work opportunities did not have that. Not everyone has access to hardware, so computers, or not everyone has access to internet. So those are again coming up as solid needs more strongly as before. So now we're looking into a consolidated form of a larger, infrastructure building. And the way that we bring in systemic design or design thinking is to ensure that empathy is at the foundation of all of those decision making. If you are proposing digitization, or if you are proposing a need and demand for new kind of jobs, are we ensuring that people who are at the receiving end are actually catered to, their influences, their aspirations, their cultural and religious beliefs, nuances, are they being catered to? So that's where we develop through design, through ethnographic design, we gather a lot of understanding of these personas. Then we derive them into different buckets to ensure that whatever we propose caters to it. So that's the undertone that I'm seeing. Somehow COVID has pushed us all to think like designers, and we're all having that problem solving approach. Another thing that I'm seeing and super happy about is a lot of collaborative work. I felt that previously, whether that was development sector or government or education or healthcare, people were working in their own domains. But this has just pushed us all to work together. I'm seeing a lot of design community working with healthcare, seeing a lot of policymakers working with creative people. There's a demand for BI, which I have not seen before. There's a demand for all of these practices.
All right.
So we see a lot of these patterns emerging.
All right. So my last question basically is from Bilal. Bilal, I particularly have a question related to the media landscape and how it has been in terms of the health communication aspects. Would you like to add something on this?
So I'd extend your question a little bit, and I talk about how media and media communications need to be really understood as a science. So all across the world, communications is a very specialized field, and with some positive and some negative examples. So we all know of the Cambridge Analytica using very sharp-edged resources to target and change behaviors, and to some extent invalidating or hijacking elections. But the message behind that is the need for taking communications as a very scientific field, requiring moving beyond biased decision making, and from our side at Gallup, what we think we can contribute to the discussion is a greater understanding of the media landscape in the country. I'd start with an understanding and a realization that the media landscape has changed very significantly over the past few years, and it's changing very radically over every month. So for example, in terms of the media decision making, one of the crucial most decision is to invest where. As Javeria mentioned, when the campaign was being designed, they thought of different vehicles to carry that message. So what does an average Pakistani actually view, hear, or read? And to what extent each vehicle reaches out to the population. So if you look at this, about 80% of Pakistan watches TV at least once in a week time. About 20% of Pakistan reads a newspaper. 80% do not read a newspaper. And about 10%, only about 10% are viewing radio. 90% do not listen to radio at all. And about 25% of Pakistan is on social media. Despite millions of people being on the social media, it's only 25% of the total population. And about 90% of Pakistani households claim to have at least one mobile phone. But these are the top line numbers. So if you delve into the deeper details of each one of them, so for example, 80% of Pakistanis watch TV, but then TV viewership is fragmented into at least 30 different channels. And the top 5 channels account for something like 60% of the viewership. And an average Pakistani views 120 minutes of TV, but then that 120 minute is clustered into prime time viewing. So if you are unaware of this particular reality of TV, you may just look at the 80% figure and then decide to invest. TV is also by far the most expensive medium. So just to give you an idea, a prime time 15-second slot can cost something like 300,000 rupees, exclusive of tax. That's very large number of SMSs, a very large number of robocalls made just within that 15-second slot that evaporates. And then the viewership is so fragmented that across the day, maybe people are not viewing TV. But then at the end of the day, TV provides a visual audio mixture that many other and it has in terms of compared to social media, it has that authenticity that the social media lacks. But if you come to newspaper, for example, about 20% of Pakistanis read any newspaper. That's not so surprising. Only 60% of Pakistan is literate. But that 20%, again, a reality is that a newspaper is not a national medium. So there is no newspaper that has national audiences. So if you go into KP, the top newspaper is not the one that you find in say northern Punjab. In Sindh, you won't even find a national newspaper. You won't find one in Urdu. The most popular newspaper is in Sindhi. But if you look at it in KP, that's not the case. Even though KP is Pashtun oriented and most people speak Pashto, but for newspaper they would rather read an Urdu newspaper, and that Urdu newspaper is not the one that is read in Punjab. So this again, that 20% is again fragmented into very regional newspaper markets. And one can get swayed by the top number or by the largest newspaper as reported by, for example, the ABC, which is a government body that provides circulation numbers. If you look into radio, for example, so radio has had a complete turnaround in Pakistan. So in 1980, most of the any sort of media consumption was happening on radio. Newspaper was as non-existent as it is right now. I mean, even at that time, about 15% were saying they were reading newspaper. TV was not there, so TV was largely restricted to just one channel, which had very limited airing time, but also TV was a very expensive gadget, so very few households had one. So people would gather at other people's houses to view TV. But radio was the largest means. But in the next 40 years or so, radio comes down to being the lowest in terms of any media. But we sometimes encounter the almost a fad that, for example, KP or rural Balochistan still would be would be listening to radio. That's particularly not true. So only apart from certain rural KP communities where TV cable cannot be provided, and that the satellite dishes are too expensive for those areas. The TV radio is a dominant media. All across Pakistan, radio is in a minority when it comes to media viewing. So radio is I mean, we sometimes find radio to be fashionable for certain enclaves or communities that are conceived or biasedly conceived to be have been left around. Our data does not suggest it. Even government's data doesn't suggest it. So ownership of radio is very restricted. In terms of social media, I think that's one of those areas where us existing in a bubble and therefore conceiving things from a biased angle affects all of us, and it's such a grave reality that it's very difficult to run out of it. So it is one of those biases that we live and breathe, and it's very difficult to run. So social media, despite its very large growth, so 5 years ago only about 10% of Pakistanis were using social media. Now 25% are viewing. So that's like a doubling, more than a doubling in just 5 years. 25, but at the end of the day, it's only 25%. So if you're looking at reaching out to all Pakistan audiences, social media is not going to help you. Even in the urban metropolitan young population among males. So if you double down every particular segment, it never crosses the 50% threshold, which are present on social media. So social media is one of those that needs to, it's a very growing field. 25% of Pakistan's adult population adds up to 30 million people, at least. Between 12 to 18, a lot of people are on social media as well. But that doesn't necessarily make it large enough for Pakistan for a campaign to reach out to Pakistan. 90% of Pakistan owns a house, or the household has a mobile phone. But that doesn't explain people who are not having that mobile phone. And sometimes it is those 10% left out are the ones that we actually want to reach. So, for example, if you are if you're leading a polio vaccination program, it is that 10% who do not even have a mobile phone are probably the ones that did not vaccinate their child because they were living in an area where the vaccinators could not reach. So mobile tower could not reach because the vaccinator also could not reach. So making a very smart use of this data is a very essential starting point. Even if you have a very great message, if you have a very well tested message in the lab or in other ways, but the vehicle you choose to throw that message is one that doesn't necessarily reach the target audience. I think it's a message lost. So we at Gallup try our best to make sure that these statistics are known, tested, and validated and understood by people who are in the communications field, and we are very willing to provide further help in this regard.
All right. Thank you so much for these valuable insights. So at the end, I would just like to have short comments regarding these webinar series and what's your insight and take about such events. Javeria, you could go first.
I think that it's really good that information and knowledge is becoming more and more accessible, because we are now, moving toward digital spaces which are accessible from anywhere. Otherwise, there were closed a lot of the time, counted events which were not accessible to everyone because of logistics or numbers of multiple reasons. So that is really good. One other thing is happening, which I don't know if I should point out here, but is because there's so many Zoom and online, platforms, it's just really hard to follow everything. It's really hard to then retain information. It's just, so that part is really hard. So maybe, more and more webinars can be slightly more engaging and interesting, where the audiences also get to be a part of it, so that there's more engagement. And there's somehow, even in this digital space, you should try to incorporate the human element. I mean, we're all talking about human centricity and behavioral insights and psychology. So it would be apt if a lot of those things are also incorporated in the way that we curate information. But other than that, I mean, I think I've learned so much in this time just because information is readily available. I can actually listen to so many people who I used to follow and always thought that I'd have to buy a ticket, that I don't have to do. So in that sense, there's both good and bad. But I think that these webinars will also soon have to reinvent, the way that they are.
I completely agree. I understand that engagement is really, really important, but there's another issue regarding the digital outreach in certain areas, the connectivity issues, and all these issues are kind of like limitations in terms of the production quality of the webinars and stuff like that. But duly agreed that this needs to develop further, and this is a valuable insight for us. Dr. Asma, please, we would like some final words from you regarding the webinar, please.
Very interesting experience, and I would just second what Javeria has already nicely summarized. There is nothing much for me to add, except that they should be very focused and brief. That's how we will make the best, out of these discussions. So there's a lot of information that I think can be shared in other ways. The discussion is extremely useful when you are brainstorming with other people who tend to think differently. And I think one of the best things that is happening on these webinars, and particularly on this one also, is that people from different backgrounds coming together to listen to each other was very helpful.
Thank you. Dr. Umar, some words from you as well.
I think in principle, dissemination, I think is important. It's interesting. So what Javeria is saying, I think in a way we could thinking about how you can embed BI into making it more engaging or getting people to take some action. Like at the end of the day, what we want is some sort of an impact. Right? So I'm willing to be here in this webinar to share what we have done, so that maybe other people might find this inspiring or learn something, and then they might actually end up doing something about it as well. So it could be us thinking, oh, well, actually, as a result of this, is there something that we can then help those people who have listened to this webinar to take something, an action as a result of this. But yeah, I mean, I think today's purpose was to share something to show that good work, good quality work can happen. With diverse people who didn't really meet before. But in all honesty, I haven't met most of the people who are involved in this ringtone. It's just through WhatsApp. I haven't even had a video conversation. But things like this kind of a collaboration, cross-functional collaboration, is possible, and hopefully, I think people who would listen to this, would feel confident that okay, you can do this.
All right. Thank you so much for your time, all of you, and your insights are amazing and valuable, and looking forward to more similar conversations and brainstorming sessions, as mentioned by Dr. Asma, that we could develop something like that in our future webinars or stuff like that. Thank you all for your time.